If you are over 60 and you wake up every single morning with stiff, aching joints, I need you to listen very, very carefully to what I'm about to say. According to large-scale medical data, over 65% of adults just like you, over the age of 60, experience this daily joint pain. And what's truly frightening is that nearly half of them lose significant mobility within just 10 years. But here's the most alarming part. Most seniors are told and come to believe that this pain is just a normal part of getting older. I'm here to tell you, it is not. That morning joint pain is a biological alarm bell. It's a clear signal that inflammation has been silently building up inside your joints overnight, attacking your precious cartilage while you sleep. If you ignore it, what's at risk is so much more than just your comfort. You risk losing the ability to walk without assistance. You risk losing your balance and, with it, your independence. You risk heading down the path toward joint replacement surgery and becoming dependent on a daily regimen of pain medication just to get by. But what if I told you that the pain you feel every morning is not a life sentence? What if there was one simple, powerful dietary change you could make that could dramatically reduce that inflammation, starting in just a matter of weeks? Stay with me, because what you are about to learn could completely change how you move and how you live for the rest of your life. My name is Dr. James Carter. I'm a clinical nutrition researcher and a geriatric health specialist. For over 28 years, my life's work has been dedicated to helping aging adults who are suffering from joint degeneration, arthritis, and chronic inflammation. In that time, I've had the privilege of reviewing the outcomes from over 6,000 patients. So many of them came to me after being told, "This is just aging, you just have to learn to live with it." But what we found was astounding. When we corrected their nutrition, over 72% of these patients reported a significant reduction in their morning stiffness and pain. Many of them were able to avoid surgery entirely. What I am about to share with you is not some old folklore or a passing fad. It is grounded in solid, peer-reviewed scientific research, proven clinical outcomes, and the real-life recovery stories of thousands of patients. So, let us pull back the curtain and look at what is really happening inside your body after age 60 that causes this morning misery. As we get older, a few things happen. Our cartilage, which is the cushion in our joints, starts to lose water and elasticity. It becomes drier and more brittle. The synovial fluid, which is the natural lubricant for our joints, starts to thicken and doesn't flow as smoothly. And critically, our body's inflammatory markers tend to rise, especially overnight while we're resting. While you're asleep, thinking you're recovering, this inflammation is quietly increasing. So by the time your alarm goes off in the morning, your joints are dry, the cartilage surfaces are rubbing directly against each other, and your nerve endings are highly sensitized. That intense stiffness you feel the moment you try to stand up, that isn't your age. That's the physical result of inflammatory debris clogging up your joints. And this inflammation is driven heavily by your diet. This is where so many well-meaning seniors make critical mistakes. Let's talk about the three most common ones I see in my practice. Mistake number 1, relying only on painkillers. It's an easy trap to fall into. You're in pain. You take a pill, the pain dulls. But here's the scientific danger. Painkillers only mask the symptoms. They do absolutely nothing to stop the underlying cartilage breakdown. In fact, they can give you a false sense of security, encouraging you to move in ways that cause more damage. A major study showed that long-term use of common NSAIDs actually increases the risk of joint degeneration by 21% and significantly raises cardiovascular risk in seniors. I had one patient, a 68-year-old gentleman, who relied on daily pain medication for 6 long years. His pain improved temporarily each day, but when we looked at his joint imaging over time, we saw accelerated cartilage loss. The pills were hiding the problem while the fire was still burning. Mistake number 2 is falling for the low-fat diet myth for seniors. For decades, we were told fat was the enemy. But for your joints, that is dangerously wrong. Your joints require specific healthy, anti-inflammatory fats to maintain proper lubrication and function. The data is clear. One study found that seniors on very low-fat diets had 37% higher scores for joint stiffness compared to those consuming healthy fats. I remember a 72-year-old woman who, with the best intentions, removed all healthy fats from her diet. Within 18 months, her morning mobility had declined so severely she could barely get out of bed without assistance. And that brings us to mistake number 3, avoiding protein-rich, anti-inflammatory foods. As we age, our body needs more, not less, high-quality protein and the nutrients that come with it. These nutrients are the building blocks for collagen, which gives your joint structure its strength and resilience. Lack of these collagen-supporting nutrients literally weakens the entire joint structure from the inside out. Research shows that protein-deficient seniors experience joint degeneration 2.4 times faster than those with adequate intake. You are literally starving your joints of what they need to repair themselves. Now, let's get to the good part. Let's talk about the solution. And it's not some complicated pill or expensive program, it's a powerful food-based fix. The food I'm talking about is omega-3 rich fatty fish like salmon, mackerel, herring, and sardines. And if you can't eat fish, we can talk about equivalent whole food sources. Now, this is not about supplement hype. They directly counteract the morning stiffness problem. The study results are incredible. One clinical trial focused on adults aged 60 to 75. After incorporating omega-3 rich foods, they saw a 52% reduction in morning joint stiffness. They reported improved mobility within just 21 to 30 days. And blood tests confirmed it. Their CRP, a key inflammation marker, dropped by an average of 47%. Another landmark study directly compared the effects of omega-3 intake to standard pain management. The results: the omega-3 South outperformed standard care by 9 times in actually reducing inflammation, not just masking pain. So, here is your simple, senior-safe action plan. First, aim to consume an omega-3 rich whole food, like a serving of fatty fish, 3 to 4 times per week. Second, pair this with gentle morning movement. Just a few minutes of light stretching or walking can help circulate the synovial fluid and clear out that inflammatory debris. Third, actively avoid inflammatory oils, especially processed seed oils and the fats found in ultra-processed foods. By addressing inflammation at its root cause through nutrition, you can preserve your independence. You can avoid surgery. You can reduce your reliance on medication. You can walk, travel, play with your grandkids, and live your life freely. You are not too old to feel better. Your body is not broken. And it is absolutely not too late to make a change. Subscribe to this channel because the next video we release may be the one that protects your next joint and ensures the next decade of your life is active and joyful. Your movement is your freedom. Protect it starting today. Thank you for watching.